patients don't know what's going on. They're scared. They're about to be cut open in a way that they don't know about. They're relying heavily on 4 people in one room to make sure they're okay. So,
howdy everybody. This is Outdoor Talk, and today we're going to do a small hike through San Gabriel River Trail. I've got my buddy Oscar right over here. He is a surgical tech nurse with a crap ton of experience. So we're going to get some great questions in for him.
This hike?
This hike, probably like a month or 2 ago.
Okay.
Yeah,
what do y'all like about it so much?
It's kind of a quiet area that no one, I'm not gonna say no one knows, but when we come, there's at the max 5 cars. And so the trail is usually pretty empty, especially when we come in the mornings or on the weekends.
So
and
it's nice and quiet.
It's quiet. It's mainly flat, has a little elevation, nothing crazy, easy. And the scenery's nice, like the tall trees on the side of the trails, the sunlight hitting down, like it's beautiful.
So far, you guys have both done some of my favorite trails so far. I realize there isn't a lot of them. Y'all keep doing ones with huge rocks fixtures on the side, plus everything else with the tree canopy. I love it.
Yeah.
But I had never done the one AJ took me to, and I was very grateful for that one. It was gorgeous. So what is it about the outdoors that you enjoy so much?
Quiet.
As I talk the whole time.
I like being in nature. I like just hearing the natural sounds that the earth makes.
I completely agree. It's gorgeous and it's so wonderful.
It's nice to know that there is, aside all the crazy bullshit we deal with every week on a daily basis of work and school and all this other crap, like this is just peaceful.
What is this?
I think it's a what do you call it? Constellation map?
That's cool. I didn't know this was here. Stargazing facts, guys. Right. It's really neat. Surgical nurses play one of the most important and intense roles in the healthcare field because they're dealing with people who are unconscious. What is your role as a surgical nurse where you work?
So as a surgical nurse, well, actually, it's a lot. Hold on, let me take a step back really quick. First and foremost, there's always a surgery board. You know what you're gonna do for the day, the type of surgery, the surgeon you're with. The thing about that though is that it can change literally the next minute, either because someone's delayed coming in, something happened to the surgeon, something happened to the patient before. The day is always changing. It's never just simple. First thing we do when we get in is we look who we're with, the type of surgeon that we're with, what we're gonna need for that type of case, as far as equipment, disposable items, positioning items, the type of bed we're gonna use, the medications we're gonna need to use. And then after we get all of that figured out, we get the room set up, we make the bed, we open. Can I just walk you through a...
Yeah, I'd love that.
Okay.
Please, feel free. I'd love for people to really get a good grasp what it is for a surgical nurse, for anyone who might be looking into getting into the field.
Perfect. Okay, so get in, look at the board, see who you're with. You start getting your room ready right away. Well, you get the type of bed you're gonna need. Sometimes it depends on the type of surgery you're gonna get, whether it's orthopedic or spinal, general. There's different beds for different types of surgeries. And so based on that, you get your bed ready. Make sure your tech who is with you in the case, they have their supplies that they need. And usually we pull all of our stuff the day before. So we know what the schedule looks like. Get all the supplies in the room. We start opening everything. The CRNA or the anesthesiologist, depending who that is, also comes into the room at some point. They'll start getting their drugs ready on their cart. They'll pull everything they need, get their anesthesia machine ready. You're ready, the tech's ready, and the anesthesia person is ready. You're not technically ready for your case. You, as a surgical nurse, have to go and interview your patient first and foremost.
Is there a reason behind that?
Yes, we're like kind of the last defense on things that could go wrong. Before the patient even gets to us, they've had appointments with their surgeon already in the pre-op calls. They've been told maybe to stop some medications at that point already too. They take a shower with a certain type of soap to get their skin ready as well. So when we go interview the patient, we always ask, verify name and date of birth, always, first and foremost. Make sure we have the right person we're gonna do surgery. Any allergies you got to any kind of medications, but it's not even just medication. People have allergies to it. So there's some dressings we can't use.
You go in, and the start of that conversation is really just making sure to verify their name, date of birth, and you said allergies. What else are you verifying?
So we're also asking if there's any metal implants that have already been implanted from previous surgeries. And the reason we ask about metal, because if your surgeon is using electrocautery, we have to put what is called a Bovie pad on your skin. And it has to go either it has to be somewhere where there's lots of muscle or there's lots of insulation. So your thighs are a big one. It can be on your belly as well. We try not to put it on any bony prominences where there's nice layers of either muscle or tissue.
Is this used for particular procedures, or is this a general thing that gets used every surgery?
It depends on what's being done.
Okay.
So if the surgeon has to open you up, they're already going to use the electrocautery because they have to cauterize your vessels that are bleeding.
Understood.
So anytime they're going to open you up, use electrocautery, some type of electrocautery.
So that's one thing you have to check for your morning routine almost.
Yes.
What else are you doing after that? After you go check in with a patient, is there anything other than that you're checking with as well?
Well, besides making sure the tech is ready, making sure they have all their supplies, making sure the anesthesiologist is ready as well. We have to wait for this anesthesiologist to go into the room so they can put someone to sleep. Usually, well, at least where I work at, there's one anesthesiologist that bounces between rooms. So we only got 5 rooms, so it's not super crazy. But they can be held up. If someone's having like a difficult intubation in a room, they'll be held up, and that holds up my case because they have to wait. We gotta make sure everything is removed off your body. You don't want nothing metal, like no earrings, no jewelry, no piercings. Everything needs to be combed off. Again, the reason because of that is electrocautery. The pad that we put on your body, it absorbs the electricity from the electrocautery, doesn't burn you pretty much. It needs a pathway to travel through.
Gotcha.
One of the big reasons we ask about pain in the specific area is to compare the pain after surgery. So if someone's in
I
pain,
wouldn't have thought of that in all honesty.
so let's say someone's in pain in their leg and they're getting something done on their ankle. They come out of surgery, suddenly they can't feel their toes. Well, they didn't tell me that they couldn't feel their toes before. They could feel everything fine. But now they have numbness and tingling.
So
It's a red flag.
A new onset symptom.
Yeah,
Which is not what you want after surgery most of the time.
correct. And the last thing we always ask, who's here with you today? Who's family? Who can the surgeon talk to? Who do we know who to contact?
So that's what you ask the patient. After that, what do you do after that?
So after that, if the room is ready to go and the surgeon is ready to go, we bring you back.
Okay.
Yeah. I mean, it's a lot. It sounds like it's not a lot.
Oh no, that sounds like a lot in all honesty. If you've ever worked in a hospital, what you just walked me through was either easily half an hour to 2 hours.
That was an
of
hour
work.
prep, yeah.
Afterwards, you're doing that for every room.
Mm-hmm.
So there's 5
Every
hours
room.
of your days. You got other patients to deal with after the first round.
Correct.
Because not all surgeries take all day.
Correct. Sometimes,
Most of them,
yeah.
they only take about an hour once you get them on the table.
Correct.
Because
Depending on
these
what you
guys
want. But
have been doing this skill for a long time most of the time.
most of the time. We have some new people that take a while, but they learn, and they get quicker and faster. And
What would be the 3 key components?
what the nurse needs to know, pretty much knowing your anatomy is going to be number 1.
Really?
Yeah, I mean,
Okay.
honestly, for any nurse, you need to know your anatomy. Because of surgery, you have to know anatomical positions and anatomical areas of the body to where the surgeon's gonna need to go into. So let's say surgeon's an orthopedic surgeon, and they're gonna work on a gamma nail in your hip. I know that a gamma nail is not necessarily in the hip, it's more lower in the femur, but you're gonna position like you would do a total hip replacement
Oh,
because it's so close.
okay.
So anatomy is absolutely key. You have to know your anatomy. I would also know about anesthesia. Now, I'm not saying super detailed anesthesia, what they use and why they use it.
What impact does that have?
Right, there's 3 different types. There's general, local, and then there's regional. And it's mainly because the patient gets to talk to anesthesia, they really do. But you're the one that's at the bedside the entire time. And the anesthesiologist is busy getting medications ready, and they're talking to the patient depending on how the patient's reacting, how the patient's doing, what type of surgery we're doing. But they're gonna ask you questions. And as a nurse, people that they trust. You know what I mean? Like automatically, for some reason, the nurse is always the one that's always trusted. And so to know what the anesthesia, am I gonna be asleep? What's the number 1 question? Am I gonna be asleep? Most of the time, yes, you're gonna be asleep. But like sometimes, the patient can choose this. They can choose not to be asleep on very simple procedures. Let's say they're doing a carpal tunnel release
Okay.
on your hand. That could definitely be done local, and what that means, the nurse gives a local anesthetic to the tech on the sterile field. The surgeon will inject it into your hand while you're awake.
I love the fact that you're genuinely doing this as medically appropriate as possible. Because you just said sterile field, and I'll tell you right now, no one in the paramedic world would even bring that up other than BMI, scene safe.
Oh yeah.
So would you say the 3rd thing is knowing how to talk to patients?
Absolutely. Communication is key because your patients don't know what's going on. They're scared. They're about to be cut open in a way that they don't know about. They're relying heavily for people in one room to make sure they're okay. So knowing how to talk to someone is absolutely the 3rd key. It might even be the 1st one, that should be honestly. To be honest, yeah. Because you have patients that come in and they're crying and they're just scared and they're nervous. And at times I do walk them through what we do because it helps them relieve that anxiety.
What are the things you find people are most scared of? You mentioned sleeping.
not waking up or dying on the table, pretty much. A lot of the times I'm like, one of the things we do is blood loss, anticipated blood loss.
Which is gonna happen
It's
in
gonna
every
happen.
surgery.
Every single surgery you have blood. Even in big cases, so there's we do a case, and it's called an ALIF 360. What that stands for is anterior lumbar interbody fusion. The 360 part means that we're gonna flip you on your belly. After opening up your belly and fusing your spine from the front side, we're gonna flip you. We're gonna open you on the back and also help fuse apart the back side.
It's intensive.
It can be about a 5 to 6 hour case, depending on who the surgeon is and their skills and their knowledge and how long they've been doing it. They hear that and they immediately just freak out, which I mean, I would too. If I didn't know anything about surgery, I would freak out too.
Yeah, of course.
So I explain, I just go in detail. The surgeon is gonna do this, they're gonna fuse you. You're gonna be asleep the entire time. We're gonna put you back on the stretcher. We switch the beds out. We're gonna flip you onto this special bed for your back. The surgeon's gonna work on your back, fuse the spine, and that's it. The point though is that they don't know anything that goes. Explaining even that little, they have a sense of what's gonna happen to me. And the anesthesia provider is there 100% all the time. They go nowhere. Sometimes the item wasn't available at the time we were pulling the case, and the supply guy gets there in the morning. They're like, oh, hey, we got this after all, go grab it. So the nurse runs in and out of the room sometimes. Surgeon's there. Sorry, go ahead.
Well, no, I was just gonna ask, if you're going in and out of the room, this sounds like a great time to ask you, how do you keep everything sterile?
Negative pressure.
I know for nursing, or for surgical nurses and surgery in general, there's no one more picky about the cleanliness, sanitization of their rooms than
Yes.
surgeon.
The air in the entire surgery core is sterile.
Crazy.
So which is why we have to wear shoe covers, hair covers, and change out of our street clothes, because that's all sterile. So that's as best as we can everything sterile. It's just, and then we don't touch the sterile field, which is even more sterile than just the air itself. All the instruments are on, all the supplies are on, that the surgeons and the techs work off of. Oh, I thought of something actually.
Okay.
When we start getting delayed, and then we have to hurry and catch up, is extremely stressful.
So that would probably be the worst part.
Yes.
Whenever you guys get a little bit of a delay.
And the thing though is that we get delays every day. A lot of times surgeries just go past the time that they're allotted, and then now we have to push everybody back, and the patients start getting upset because their surgeries are getting pushed back, but it's not really truly no one's fault. Maybe the surgeon found something and needed to fix something else while in there. Maybe he was having just a little bit of trouble fusing a plate, putting on a nail. Like any little thing is gonna start delaying time. And so once that starts happening, and so our day also gets pushed back, and so we're there later as well. So that is stressful.
So then what do you find the most joy with?
When I take them to PACU after everything's done, sometimes they're awake, sometimes they're not. Actually, to be honest, most of the time they're not awake yet. They take a little while to wake up. On the way to PACU, you know, sometimes the anesthesiologist, depending on the patient's conditions, comorbidities, they'll wake them up in the surgery room, and then we'll take them to PACU. That way the anesthesiologist knows the patient's awake and they're not going to struggle in PACU. But at that time, usually, they're still, you know, a little sedated and they're under medication. And I'm like, they'll ask like, hey, how did my surgery go? And I'm like, it went great. You know, the surgeon was able to do what he needed to do. And you just see this relief. Like if say someone got like a total joint, like a new knee, like, you know, their life's gonna be changed. They're gonna be able to walk and run and do anything they wanna do like they had a regular knee. They were having all this pain before. And you just like, they're like, oh, you can just tell they're gonna be better. Like you actually make people better.
And you're getting to see their reaction firsthand.
Yes.
Which is always really rewarding. Why did you go into nursing? What was your sense of purpose behind going into nursing?
My mom was a nurse assistant way back when I was like super little. My mom worked with the older population, and I remember going to work with her a couple of days. And they were just so happy. Someone was there just to listen to their stories, and I grabbed onto that. And so I went to CNA school. I was a nurse assistant. I worked in nursing homes. And I absolutely loved my older population that I took care of. Just getting to sit there and talk to them, just listen to their stories, what they've been through. It's just a glimpse into their life that they lived long ago before you were even here on this earth. That's what gravitated me towards just the healthcare field. Now, as far as nursing goes, after I became a nurse's assistant, my director of nursing at that time, I've seen how you talk to your patients, how you care for them. She's like, you'd make a really great nurse if you ever wanted to. And I took with that and I ran. And so I went to nursing school. Got my LVN. I still worked in nursing homes, taking care of the older population. And I wanted to move up. So I was like, okay, let me go get my registered nurse license. Worked in the hospital. It was a little different, definitely different actually. Did med surg floor. That was actually a little rough. You don't get to sit and talk to your patients as much as you'd like to, unfortunately.
That's understandable. You went on the floor, and then what transitioned after that?
So I went on the floor during the second wave of COVID.
COVID, okay.
Yeah.
That was a tough time
Yeah,
in healthcare in general.
correct. And we had patients, unfortunately, passing away on the daily, more than once. I was like, what can I do? It's not that I didn't want to deal with death. I needed some light. I was like, what can I do to help people get better? Anyways, I found surgery.
No, yeah.
I mean,
you figured, okay, this wasn't the field I liked. I loved it when I was in the nursing homes. What's the next field that I can do that's going to keep allowing me to achieve and excel beyond what I am at right now?
exactly. I love that you can find the words that I cannot find.
Hey, you're saying it, I'm just phrasing it in ways that make sense to me. That's all it comes down to. You're doing this now, and if you've been doing it for 5 years, it sounds like you really do enjoy it.
I do.
What are you going to school for? Because you mentioned that earlier to me as well.
Yes.
That you're trying to go back to school, and what are you looking at doing with that?
So I started at the very bottom. I guess you can say the quote unquote bottom as a CNA, nurse assistant. I worked my way up through LVN, RN, I got my bachelor's. I'm now going to school in March. I'm gonna start working on my master's in healthcare administration.
Healthcare administration, okay.
Yes, I want to help everyone from the top. Unfortunately, in healthcare, top people are not seen very much and are kind of known for not being around and just collecting money and telling people what to do, and kind of that CEO kind of like, from someone who's down here, they don't see the people up here very much. And I don't want to be like that. I want to change that. And so
just to clarify, y'all, if you didn't see the shadow, it was here to here. See my hands, and I'll tell you right now, that gap is more than just our hands.
Yeah. Every patient, I try and find a connection with everyone that I encounter, to be honest.
How does that benefit you in your field?
It makes me care. It helps me care more because we're all human and we all have a story to tell. And I'm like, what's your story? I have a story. I'm not gonna tell you my story, but
yeah.
I wanna hear your story. I like that. Like my patients, what do you do for work? What do you do for fun? Like, what do you like to go do? I try to avoid the how did you get hurt question because no one wants to be there already in surgery, much less explain why. But yeah, I just try to make a connection with my patients, every single one of them, just to know that I'm here, I'm human, and we're here to take care of you.
So obviously this job is very stressful, or it can be at times.
Yeah.
What are ways that you find to reinvigorate yourself and get you back to that stationary position of being joyful when you show up at work?
Well, I do work out. I make sure I get lots of physical activity. It keeps my mind clear, keeps my mind sharp. There's something called the AORN, which is the Association of Operating Room Nurses.
Say that one more time, I'm sorry.
Association of Operating Room Nurses. And so that's a guide, entity we follow guidelines off of.
They're the ones that probably do the most updates.
Yes.
Or the most recent updates.
Correct.
Different things along those lines in the medical field.
Yes.
And there's tons of those out there, y'all.
Yes, there is a lot. But I keep up with head articles that are coming out on different medications you can give patients for different types of procedures and different methods surgeons can use. I read up on it just because I like reading that stuff. It just helps me also keep my mind sharp and keep me. My left hammy for some reason is starting to cramp a little bit.
Oh, sorry, bud. We're almost done.
Oh, no, you're good, you're good. We hit 5 miles.
You guys tell me about what y'all enjoy about what you get to do. Genuinely brings me so much happiness, especially that you guys are willing to let me share with other people.
Oh, absolutely.
Is there anything that being outdoors does differently than some of those other activities? Or being with friends?
I feel like if I could have been born in an era, it would have been this.
Okay. Why is that?
I like to be out in nature. I like to be grounded. I will go lay out on my grass and just lay in my grass. If I could be a hippie, I would be a hippie. Like,
no,
that makes me
we need
happy.
you in the surgical centers and other places as administration to make sure these people are doing their best jobs. Because I'll tell you right now, the person I want in those positions is the person who only does it so they can help.
Yeah.
Not because of the pay raise, not because of anything else. Because they make a bigger impact on someone on a day-to-day basis than the person who's just smart and wants to utilize that for their own good.
Right. But just being outside in nature makes me happy. And me being happy transfers to my patients. Kind of like that saying, if you're not happy, how are you going to make anybody else happy? Or something like that. Something along those lines.
I've heard that saying, but I like it. No, I like that. If you're not happy, how can you assist in anyone else's happiness? It reminds me of when I went and did lifeguarding years ago. They always had to do the scenario of if you were on a beach. If you're drowning, you can't save anyone else.
Correct. That is
And
very
so
correct.
the whole, is there anything you would suggest for a nurse getting into nursing right now? Things they should be looking up, things they should be doing, things that will help them keep
Anatomy.
along.
Anatomy. You have to know your anatomy. If you don't know your anatomy, you don't know how your disease processes work in your body. You really have to know how you function. You have to know how the body functions in order to understand how medications work in the body, and then pretty much how your disease processes work in your body, which is pretty much all what nursing is learning how to take care of these certain types of diseases, reactions you have to medications. Anatomy, 100%, in my opinion, your basis of what you need to know. I would say get an anatomy book and just start reading, or flashcards. Anything to help you, however you learn anatomy.
How'd you learn?
I had
What
to
were
have
some of your go-to ways that you did?
I had to have physical books. I couldn't do computers. I like physical books because I like to highlight and I like to make notes and write. So I bought all physical books for my education.
Okay.
Just don't ever forget why you got into it in the first place. Everyone gets into it usually for a reason. Either they lost a loved one,
Or they wanted to help old people
or they wanted to help old people.
and hear their stories.
Whatever it is, just don't ever forget sight of that.
All right, everybody. Thanks for coming on our walk today. I hope you learned something new about surgery and the nursing field. Oscar, I really appreciate you coming out and doing this. There's going to be some people who got a lot of really great input. Is there anything you wanted to share?
Just get outside. Get outside at some point every day. Get into the sun. Go take a walk.
That way you don't look so pale, like me.
Just help you feel better. Release those endorphins. Feels good.
Thanks again, bud.
Absolutely.
Thanks everyone for joining us. I hope you all have a great day. This was Outdoor Talk.
Knowing how to talk to someone is absolutely the third key. It might even be the first one, that should be honestly. To be honest, yeah.